Multiparametric magnetic resonance is increasingly used in the management of prostate cancer. Magnetic resonance spectroscopic imaging, or MRSI, may be especially valuable in assessing cancer aggressiveness, currently one of the most important challenges in prostate cancer management. In prostate MRSI, the proton signals of citrate, choline, creatine, and polyamines are recorded. In tumor tissue, the levels of citrate are lower than in healthy tissue, whereas choline levels are usually increased. Therefore, the ratio of choline over citrate is an attractive biomarker to detect prostate cancer. However, prostate spectra often suffer from contamination originating from lipids surrounding the organ. These lipid signals can overlap with those of citrate and cause uncontrollable phase effects. This is a problem for quantification and tumor characterization, especially at the margin of the prostate where most tumor foci are located. Therefore, our aim was to develop a 3D MRSI sequence which produces reliable spectra across the whole prostate without spectral contamination and within a short acquisition time. Here we present a prostate semi-laser sequence with gradient-modulated, offset-independent adiabaticity pulses, or GOIA pulses for short. In Figure 1, you can see the pulse diagram of the semi-laser sequence with our implementation of the GOIA refocusing pulses. After excitation with the slice-selective Schneller-Roux pulse, the signal is refocused with 2 pairs of WURST-modulated GOIA pulses, producing a spin echo at an echo time of 88 milliseconds. Water and lipid signals are suppressed using megapulses and outer volume suppression bands. The interpulse delays were optimized to maximize the amplitude of the inner doublet of citrate and to minimize the side lobes. This increases the signal-to-noise ratio of citrate and minimizes the overlap of the outer resonances with neighboring resonances. GOIA-WURST pulses have a modulated gradient shape in addition to the frequency and amplitude modulation used in most adiabatic pulses. This time-dependent gradient affects the frequency sweep experienced by the spin system in such a way that the adiabatic condition can be fulfilled with a much lower RF power. As a result, GOIA pulses need less RF power than other adiabatic pulses, but have the same benefits. We show in simulations and phantom measurements that the GOIA pulses have a flat and sharp slice profile and a high bandwidth of 10 kHz to reduce the chemical shift displacement error. The relatively low RF power enables the use of an endorectal coil, which has more strict SAR limits. This allows us to obtain 3D MRSI measurements with a high signal-to-noise ratio in a scanning time of about 10 minutes. In Figure 2, you can see MRSI measurements of a patient with biopsy-proven adenocarcinoma in the peripheral zone. We compare the GOIA semi-laser measurements on the right with the commonly used breast measurements on the left. In spite of the outer volume suppression bands placed around the prostate, lipid contamination can be recognized. We chose the same 4 voxels in both MRSI acquisitions for comparison. The majority of the breast spectra are distorted by lipid signals, whereas for the GOIA semi-laser measurements, the metabolite resonances are well separated from lipid resonances, or the spectra are even completely lipid-free. In the red breast voxel, the enhanced choline signal cannot be recognized because of the large lipid signal disturbing the whole spectrum. In the GOIA semi-laser measurement, this voxel clearly shows a pattern typical for tumor tissue, namely a high choline and a low citrate level. Figure 3 shows spectra of voxels within tumor tissue on the left and healthy tissue on the right, both obtained with a GOIA semi-laser sequence. The spectra show a flat baseline and a good signal separation. Again, you can recognize the enlarged choline signal and the decreased citrate signal in the tumorous voxel on the left side. Furthermore, we can detect myoinositol and taurine. This is because of the shorter echo time with better signal-to-noise ratio. The signal-to-noise ratio of the citrate and choline signals were compared between the GOIA S-laser and breast pulse sequences in 5 patients. In all measurements, the signal-to-noise ratio was larger for the GOIA semi-laser spectra than in the breast spectra, about 2.6 times for citrate and 1.3 times for choline. The mean values are shown in Table 4. This high signal-to-noise ratio is due to the shorter echo time of 88 milliseconds and the advantageous J modulation of citrate. Furthermore, we analyzed the spectral quality by calculating the percentages of voxels in which the fit of metabolites citrate and choline have a Kramer-Rao lower bound below 20%. Citrate can be detected slightly better in the GOIA laser measurements, choline even by a factor of 2. To conclude, we have developed a semi-laser sequence with high bandwidth and low RF power GOIA refocusing pulses, enabling 3D MRSI with an echo time of 88 milliseconds in the prostate at 3 Tesla with an endorectal coil and clinically feasible scanning time of about 10 minutes. The improved localization and the reduced chemical shift displacement error substantially lowered the lipid signal contamination. We demonstrated improved signal-to-noise ratio throughout the prostate and were able to better quantify citrate, choline, creatine, and additionally to detect myoinositol and taurine. Thank you very much for listening. For more detailed information, please check out our article.